Eric, let's go and look at the slides. We'll start off with our general slide. Unfortunately, at 1,335 new cases is what we're reporting. This is trending upward. We're now, you can kind of see the trend of the last 21 days. We're over now 1,000. There was a time not too long ago when we were dipping below 1,000. We're over 1,000 now, so we are concerned about that. Let's go to the next slide, Eric, which is really a kind of a new slide. It's based on the same information that you have seen before, but I thought it might be interesting. We really have two things that we look at every week, and on Thursday we'll announce the new color code. We'll give the new list for 1 through 88 counties as far as the incidents, and those are two really different ways of measuring, the situation that you have in your particular county. So I think it's, we wanted to kind of put these two together. And so what you're going to see on here is just the red counties right now. And then the other counties that you see on here that are kind of a orange yellow, I'm not quite sure what that is, but the other color there are counties that have a high incidence of the virus. High incidence counties are ones with greater than 100 cases per 100,000 population in the last 2 weeks. And so the rest of these counties are counties that don't fall into either one of these categories. So to summarize it, these are the counties that we would worry the most about. Doesn't mean everybody else doesn't have something to worry about, but these are the counties. These counties are the ones that you have something else, they're at either a high incident level or they are a red because they've met enough of those 7 indicators. So again, we do kind of see a pattern over in the western side of the state. But that's, again, a new map. We'll put that up so people can see it. It is a combination of several other maps, and we kind of put them together in a different way to look at. Eric, let's go to our top 20 Ohio counties ranked by highest occurrence. And again, we start with Mercer. Athens is now number 2. Looks like Putnam, Fulton, Dark, Defiance, Fayette, Henry, Wood, Auglaize, and then we drop to Lawrence, and we keep going from there. Again, it is of interest just geographically. Most of these, first of all, are rural counties, and second, with a couple of exceptions, most of them are in northwest, western part of the state. Let's go to the 88. Eric, you're showing that one there, and again, that is up, and anyone can go take a look at those 88 counties. You can see where your county is ranked. Again, this is by a number of cases. The last 2 weeks. Let's talk for a moment about hospitalization. Hospital admissions had been declining for many weeks since our peak in mid-July. Unfortunately, we started to see that trend change a few weeks ago. As a reminder, hospital admissions are a lagging indicator. The data comes a little later as folks in the hospital go to some hospital for something that they need particularly that kind of care. So let's look at several of these. This is number of hospital admissions, and you can start to see a trend. This starts over here in April, goes all the way across. If you can't read, it goes to the week that we are into now. These data fills in late sometimes. So we might get information today that might indicate back here, or might indicate here. And so it's probably best not to look at this week because it hasn't filled in fully. But you do start to see a trend going up a little bit, not marked on there yet, but we see that trend. Our data team showed me some things this morning I want to share with you, and they've taken hospital admissions and they've really come up with different ways of looking at this. This is hospital admissions by age. As we said earlier, in August and September, spread among the young and healthy, we are afraid will eventually impact those who are older and more vulnerable. The average age of COVID cases, and this has gone up, and unfortunately, so is the average age of hospitalizations. So this is a relatively new trend. In fact, in recent weeks, Ohioans 60 and older now account for about 70% of COVID hospital admissions. This is considerably higher than the 50% that we saw in July. It's only natural, I think, to see older people are the ones going to the hospital more, but we have seen a marked change just since July. Again, 50% of the people going into our hospitals for COVID in July were 60 years of age or older. Now that number is up to 70% who are 60 years of age or older. So again, you can kind of see, and we'll make this available on our web page as well. What you see, the colors, the darker red, purple. This would be 70 to 79. This would be 80 plus. So you can look at these colors. And these are the two interesting. They're all interesting, but you can look at these two colors, and what you will see is that the older population, is taking more percentage of those cases going to the hospital of that population. Eric, let's look at the next one. This is hospital admission by county type. So we break it down into urban counties, suburban and small metro, and rural counties. And what we're starting to see here, what we are seeing here is the red, the rural, again, comprise more of the total number of COVID cases, COVID admissions into hospitals, people with COVID who are going into hospitals. And so these are just interesting trends. More rural, we're seeing it more rural, and we're seeing it older. And now let's look, another way of looking at this is percentage of hospital admissions by region. And again, these are the regions. You'll be able to pull this down, and you can just kind of make your own conclusions here. But the green, which is Region 1, Northwest Ohio. And so we're starting to see that. We're seeing relatively fewer residents of the Cleveland-Columbus area being admitted with COVID. At the same time, our three western regions, 1, 3, and 6. 1, 3, and 6, as you see them there, are seeing a greater percentage of hospital admissions, along with some increases in regions 7 and 8, which is Southeast Ohio. I will make it clear, all of our regions have adequate capacity remaining in the hospitals. We're certainly keeping a close eye on it, but we are okay. But it is a geographical switch, and we're seeing an age switch.